The decision to undergo surgery is a very big decision. Once you've decided that and you've gone ahead and prepared yourself, now you come to the hospital and things are going to happen the way you've learned they will happen. You'll check in early in the morning, depending upon the time of your surgery. You'll be up in the pre-op holding area where the nurses will again go over a lot of your history with you in detail to kind of cross and double check, make sure we're not missing any problems with allergies, medications, and that all your testing is up to date. That'll all be checked several times, and particularly the day of your surgery. In the pre-op holding area, you'll bring a family member there. We like to have family involved because I want all the support systems involved as possible. And in that pre-op holding area, it's nice to have a family member sitting there with you to give you the moral support. I will come over and visit with you and confirm which joint we're going to operate on and actually mark it with a marker. You'll be asked several times about which joint. We want you to tell us. It's important, and actually it's a Joint Commission or National Hospital rule that you have to tell me and I have to mark it. The other thing that will happen is the anesthesiologist, a member of their team, will interview you as well and go over again a lot of the same history questions and medication questions that you've already answered. And they'll discuss the anesthesia that's going to be given to you. 99% of the time we favor the new spinal anesthesia technique along with some heavy IV sedation, or occasionally they'll even put you to sleep along with the spinal anesthesia. The reason I think spinal is the best way to go, whether it's a hip or knee, is because it really helps your perioperative pain. It's a wonderful way to wake up and not have any pain for 6 to 12 hours after surgery. It allows you to recover quicker, get up and move faster, and give you a nice jump start on getting out of the hospital faster. After you've had that pre-op consultation with the anesthesiologist as well as myself, you'll then somebody from the operating room will come out and meet you and take you back to the operating room. A lot of times on the way back you've already been given some pre-op relaxation medicine, so you may or may not remember a lot of this, but you'll come back to the operating room and again be greeted by the operating team, and then that's when the process begins. You're brought into the room, and if you're cold, make sure you tell them, because they can always give you warm blankets. Our goal and the whole team's approach is we want to keep you comfortable, and not only do I want it, but the anesthesiologists and all the nurses are all watching out for your best interest. You'll have your surgery, probably won't remember a lot of it. You'll go to the recovery room, and there will be another whole new team of nurses that will watch over, make sure your vital signs are okay, make sure you don't have any major complications like blood loss, etc. And again, keep in mind those are extremely rare. And then once you're stable enough for an hour or two after that, you'll go back up to the floor. The thing you need to know is I will go down and talk to your family again in person, and I'll tell them everything and how everything went. I'm a big believer in good communication to you as well as your family, so we go the extra mile to make that happen. Once you go to the floor, that's when it all starts. That's your post-op recovery phase. And I'm going to talk a little later about that, but you need to understand that the most important part in summary is you come well prepared, bring your positive attitude, and remember, we're all going to be looking out for your best interest. Our number one goal is to make this as a positive experience as possible for you. Thank you.